Hello everyone, this is Syed Sagheer Ahmed. In this video, drugs for congestive heart failure part 2, I am going to explain the mechanism of action of different categories of drugs used in the treatment of congestive heart failure. Before watching this video, please do watch my previous video, that is drugs for congestive heart failure part 1, where I have explained definition and causes of congestive heart failure, different categories of drug which are used in the treatment of congestive heart failure, and mechanism of action of cardiac glycosides. This video is the continuation of part 1. So let's get started. The second subcategory of inotropic drug used in the treatment of congestive heart failure is sympathomimetics. Sympathomimetics are the agents which mimic or enhances the action of sympathetic nervous system. It is also known as adrenergic drugs. The sympathomimetic drug used in the treatment of congestive heart failure is dobutamine. Dobutamine is a positive inotropic drug that increases force of contraction of heart. How it will do that? Let's see. Dobutamine is a beta-1 adrenergic receptor agonist. It binds to beta-1 receptor in the heart and stimulates it. That increases force of contraction of heart. If force of contraction of heart is increased, then ventricles of the heart are contracting properly and completely. This leads to increased cardiac output. Cardiac output is the amount of blood ejected by the heart in a minute. Here, force of contraction of heart is increased and ventricles are contracting completely. Finally, cardiac output increases. Dobutamine is also having a minimum effect on beta-2 receptors that stimulate beta-2 receptors and causes vasodilation. Hence, this category of drugs can be used in the treatment of congestive heart failure. The third subcategory of inotropic drug, that is phosphodiesterase third inhibitors. The word itself giving the meaning, these are the agents that inhibit the enzyme phosphodiesterase 3. Example, milrinone. Now the question is, how CHF can be treated by inhibiting phosphodiesterase enzyme? What is the relationship between CHF and phosphodiesterase? Let us understand. Usually, phosphodiesterase degrades or hydrolyze intracellular cyclic AMP. Intracellular cyclic AMP is a secondary messenger that increases the calcium concentration in the heart, that is very much required for the contraction of heart. Now, inhibition of phosphodiesterase may increases the concentration of intracellular cyclic AMP by preventing its degradation. Increase in cyclic AMP in turn increases calcium concentration in the heart. That finally leads to increased cardiac contractility or force of contraction. Now force of contraction is increased, hence the problem of congestive cardiac failure is treated. Second category of drug to treat congestive heart failure is renin-angiotensin system inhibitors. In this, ACE inhibitors are preferred. The concept of renin-angiotensin system is explained in my previous video, that is antihypertensive drugs part 1. However, once again I'll brief here. Whenever the flow of blood towards the kidney is reduced or whenever blood pressure decreases, at that time the specialized cells present in the kidneys called as juxtaglomerular cells secretes a hormone renin. This renin is transported to the blood where it converts angiotensinogen into angiotensin 1. Now, angiotensin converting enzyme convert angiotensin 1 to angiotensin 2. Then angiotensin 2 bind to AT1 receptor that leads to vasoconstriction and sodium water reabsorption. Vasoconstriction is nothing but contraction or constriction of blood vessels, or we can say a narrowing of blood vessels. In case of sodium and water reabsorption, sodium and water enters into the kidneys for elimination, but rather than eliminating, these sodium and water are transported back to the blood. That increases plasma volume. All these effects finally leads to increase blood pressure. Now the question is, how AC inhibitors are helpful in the treatment of congestive heart failure? Listen. AC inhibitors such as captopril inhibit the enzyme ACE. This will block the formation of angiotensin 2. That decreases vasoconstriction. In turn, it leads to vasodilation, that is relaxation of vascular smooth muscles. Also, it decreases the reabsorption of sodium and water. These effects decreases preload and afterload. Preload is the load of blood falling on the ventricles during end diastolic phase of the heart, and afterload is the pressure of the ventricles to push the blood into the arteries during ventricular contraction. The concept of preload and afterload is explained in detail in my previous video, that is treatment of congestive heart failure part 1. Here, decrease in preload and afterload increases cardiac output. You know one more action of AC inhibitors that really helps to manage congestive heart failure? Yes. AC inhibitors inhibit the degradation of bradykinin. Bradykinin is an inflammatory mediator and it is a vasodilator. AC inhibitors inhibits the degradation of bradykinin that increases the level of bradykinin in the blood, which causes vasodilation and decreases preload and afterload. Finally, it increases cardiac output. Diuretics can also be used to treat congestive heart failure. Here, high ceiling diuretics like furosemide is preferred. Diuretics are the agents which increases urine output by increasing the elimination of sodium and water. Elimination of sodium and water resulted in decreased plasma volume and it relaxes vascular smooth muscles. Specifically, increase in the elimination of sodium leads to relaxation of vascular smooth muscles because sodium is an excitatory ion. When the concentration of sodium in the blood is increased, it causes vasoconstriction. If sodium is eliminated, the concentration of sodium is reduced. That leads to decreased vasoconstriction and it relaxes vascular smooth muscles. These effects leads to decrease in preload and decrease venous pressure. Finally, cardiac output is increased, hence the problem of congestive heart failure is resolved. One more class of drug are vasodilators. By looking into the word itself, we can say these are the agents that dilates or relaxes vascular smooth muscles. Vasodilators reduces death rate in patients with congestive heart failure. Arteriolar dilators such as hydralazine relaxes arterial smooth muscles. When arterial smooth muscles are constricting, it resists the flow of blood within it and increases peripheral vascular resistance, increases blood pressure, finally increases afterload. When arteriolar dilators are administered, arterioles are relaxed, it decreases peripheral vascular resistance, decreases afterload, and finally decreases workload on heart. See, when arteries are constricting, it resists the flow of blood, it increases afterload, and it is hard time for the heart to push the blood. It is really hard time for the heart to push the blood, and heart is in a very high pressure, workload of the heart is more. Arteriolar dilators decreases afterload and decreases workload on the heart. By reducing workload of the heart, congestive heart failure can be managed. Venodilators such as nitrates decreases venous returns to the heart, decreases ventricular stretching, decreases preload, and finally decreases cardiac oxygen demand. In case of increased preload, the blood remains in the ventricle that causes overstretching of ventricles. When ventricles are stretched, then really it is a tough time for the heart to push the blood from ventricles by contracting. To do that, heart need more energy and it demand for more oxygen to pump the blood. But in congestive heart failure patient, heart is unable to receive sufficient oxygen. This might be due to coronary artery disease. In such cases, CHF can be managed by reducing preload. If preload is reduced, then oxygen demand by the heart can be reduced and CHF can be managed. Sometimes beta-adrenergic blockers are also used along with other drugs to treat congestive heart failure, even though they are negative inotropic drugs. It is just to prevent alterations which might occur due to overstimulation of sympathetic nervous system or to prevent unwanted effects of noradrenaline on cardiac muscle fibers. Patients with severe heart problems may have increased level of aldosterone due to the activation of angiotensin II. In this case, aldosterone antagonists such as spironolactone can be preferred. It prevents sodium reabsorption, hypokalemia and hypertrophy. Hypokalemia is nothing but decreased potassium concentration. In hypertrophy, heart muscles are thickened and it makes harder for the heart to pump the blood.